couple decades ago, United Way, we were involved with, of course, law enforcement and the judicial system about closing the pill mills that were here. Broward was like the highest capita of pill mills in the country. So there was kind of these doctor shops on all these different corners, and it was really people going in and getting OxyContin or oxycodone, and we helped to get those closed. However, what happened is there was a whole series of folks who were addicted to opioids due to the pill mills and going doctor shopping and getting prescriptions. And so now there wasn't that access anymore. And then folks really had to turn to alternatives than just their prescriptions. So people started to sell, there's opportunity now. So people started to make and sell heroin and then started to cut it with fentanyl. And we know that fentanyl is so lethal and so addictive that we have people in our community and throughout this country who are dying on a daily basis due to drugs that are laced with fentanyl and other synthetic drugs. So one of the things about closing these pill mills, but didn't realize that there would also be this, in a sense, a negative consequence of so many people addicted, and now where are they going to get their opioids? Addiction is a very complicated medical issue. People think someone that's addicted to drugs or alcohol, that it's a moral failing, or that they should just say, oh, no thanks, oh no, this is not good for me, I shouldn't do this anymore. It is not that simple. I want people to know that addiction is a medical issue. It is a chemical imbalance that happens for some people. It doesn't happen for all people. So if you listening to this and you don't have addiction issues, you should be grateful, because people that do have that propensity for addiction, I just call it the addiction chip. Somebody can sometimes take one opioid because they've had an operation and they literally, all their cells, all their system in their body changes because they instantly become addicted to that. Some people become addicted over time, whether it's to drugs or alcohol. Folks that have addiction issues, they cannot be social drinkers or social marijuana users or social pain medicine users. And our system is not set up for the true treatment of folks that have addiction issues. We know that insurance will pay for people to go to treatment or to mental health care, but they pay for 28 days. 28 days is barely enough time to get the fog out of your system before you can actually start to really think about recovery and how are you going to move forward without this drug or this alcohol or whatever your addiction was. And how do you become like a normal citizen but not using at that point? It would be like telling somebody, all right, you can't breathe anymore, you can't eat anymore, that's just off the table for you. I mean, that just can't happen. It's very, very difficult. And our system is not sensitive to people with addiction issues. If I come into you and I say I'm a diabetic, you're going to do some testing and we're going to talk about it, and I'm going to be on diabetic medicine, and I really have to change my diet, and I have to take my medicine, and I have to see my doc, and you're going to be sympathetic to me, and you're going to work with me, and I'm going to share with my friends and my family that I have diabetes or heart disease or something. If you're an addict, you don't get that same type of collaborative care. You don't get empathy. You don't get, oh my goodness, I'm so sorry that you have this. It's the same thing. It is a medical issue, and we have to start to treat this, that this is a health issue that they battle and that they fight with, and that they need all the support that we can have. Medical support, psychological support, funding, insurance to pay for more than 28 days of treatment. So at United Way, we have something here we call the Commission on Behavioral Health and Drug Prevention. And it's part of our health pillar, because having a healthy mind, a healthy body, a healthy psyche is all important. And we want to normalize addiction and people that have addiction issues. So we have about 100 folks who sit on the commission from all different avenues, walks of life, people who are formerly addicted, parents who have lost people to fentanyl overdose. We have the medical examiner, the sheriff's department, the Broward Health, Memorial Health. We have nonprofits. We have elected officials. We have an enormous amount of folks who sit on our commission. And we break that commission up into 7 action teams. And one of those action teams are called the Community Response Team. And that is in response to the opioid epidemic here in our community. So we have folks who chair, who vice chair. We put together an opioid action plan for the entire community. The plan that we're in right now is from 2022 to 2025. And it lists all the tactics and the strategies of how we are trying to fight this opioid epidemic and prevent it from happening, and preventing people from, 1, getting addicted, 2, from people buying drugs that are laced and synthetic, and then 3, of course, really moving forward the prevention method and the prevention story here in our community. And one of the programs that we fund here and we work with our community on is being present in the emergency rooms. So often people might take a dose and the EMTs come out. Our firefighters and our medics are amazing. So they all have Narcan. They're all equipped with that. So they come out to a scene, they can revive somebody right on the spot, and they obviously bring them to the emergency room. So we want to make sure that we have a prevention specialist at that emergency room within 30 minutes of someone being taken there on an overdose. Because when somebody is at their lowest, when they've overdosed but not died, thank goodness, you want to start now to talk to them about treatment, right? If you wait to the next morning or the next day, they start feeling better, so they start saying, no, I'm good, I understand, I'm going to go to treatment, I'm going to do this. So you have to get people when they really do feel their lowest. That we want to be able to see them experience what they're experiencing, show them that there is definitely help that they can have. There's plenty of treatment centers here. There's plenty of people willing to work. There's plenty of people who have overcome their own addiction to opioids and now working with folks in our community. And if it's somebody that's not addicted, we want to make sure that they don't ever take another pill again from a friend, from a colleague, off the internet, ordering it from somewhere, because we know for sure that one pill can kill. Everybody's journey with addiction or drug use is different. It really is. It's very individualized. Some people have a great deal of difficulty getting into recovery and staying clean and sober, not using again. And that's okay too. We need to be forgiving of people who relapse. We need to be okay that that is part of the journey. We should not be kicking people out of treatment because they have a relapse, or, we should be having some low barriers for folks to be able to stay in treatment even when they have a relapse. There are many treatment facilities through our nation. Some are funded through their counties or their cities, and they're low cost or no cost. Some insurance pays for, some are, that you pay on your own, but there is many avenues for people to seek treatment and to get help. There's 800 numbers, that folks can call, whether they're community. Anyone that's listening to this right now and lives anywhere can call 211. 211 is a information line and a helpline. Every 211, every area has 211. 211 can tell somebody where they can get help that day, whether they're experiencing a mental health crisis, whether they are experiencing addiction, whether they are worried about a child, a spouse, a neighbor, a coworker. 211 can guide somebody for what is available in their community to assist them, whether, again, it's treatment or even someone to talk to, somebody to discuss what they're feeling and what they're experiencing. Not everybody needs treatment. Some people need somebody just really to talk to and for them to be listened to. So there's a great deal of resources in their community. Here at United Way, we're here to serve the community. Our mission is fighting for the health, education, and financial prosperity of everyone in our community. And under health comes that piece about addiction and behavioral health and mental wellness. We have a surveillance team, we have an epidemiologist. We want to track all the programming that we're doing and all the funding that we're doing to make sure that it's making a difference. So we track on a monthly basis, obviously a quarterly basis, an annual basis, and thank goodness opioid deaths have gone down. We work with the Sheriff's Department, we work with the Fort Lauderdale Police Department, we work with the Medical Examiner's Office. We have a team of professionals that are in the community trying to collect data on a daily basis so that we know what interventions are working, what prevention methods are really making a difference. We have a great treatment focus here in our community, but we want to start before somebody needs treatment. We want to start in the prevention area. We want to educate people as young as we can about the dangers, of drug use and what can happen and what happens to your body and your brain, and of course what can happen if you take a lethal dose where that you are really dying at the same time. So it is really, really important that a continuous message comes out into this community. We have to take care of each other. There's a lot of crisis that's happening in our country, in our world, in our communities, and we don't know what's happening in people's families. We always have to give people grace if they are having a bad day or they're angry, or we don't know what goes on in people's worlds. So we have to be that open, empathic provider for folks. We want the community to be able to rely on United Way for all that they need. So changing one life, saving one life saves hundreds. And then if you add those up, it's hundreds of thousands. And through the country, it can be millions. If we could prevent people from overdosing and dying from opioids, I mean, it saves communities.